Patient's coming in for removal of a swelling on her right cheek. How long's that been there for you now, would you say?
A couple of years.
So it's got more symptoms than it looks like. It's coming to a bit of a head through here, and you can see where we've delineated the outside aspect of it. It's a little bit bigger than it looks. It's kind of these in-between sizes where you're stuck with, incisions will be a little bit different. How wide an area you take out will be a little bit different. What we worry about here, obviously, most importantly, is cosmetic results. I'm working with Dr. John again today. So those lines that dictate, better surgical healing, what are those lines called?
Langer lines.
Yeah, Langer's lines. And which way do they run in this particular plane?
More like oblique.
Yeah, so here at the eye, they come around almost exactly horizontal, and then they sort of fade off from that perspective. In the cheek, they come around like this. So mostly horizontal, so I'm just going to do more of a horizontal incision than a diagonal one, but I wouldn't do a vertical one. No pain here when I do that?
No.
So the challenge here is as we get a little bit wiser in years, our skin becomes more elastic, which is great from the standpoint if I did an actual elliptical incision, it'll heal nicer. But if I do a linear incision, try to dissect that down, it'll fight me a little bit. And that's what I'm going to start with, just to sort of see whether we can get that to come out sort of more intact with less irritation. So this will be fairly tedious work.
Is there caps on this as well?
This will be the issue. So if this is like an epidermal cyst, the answer is yes. If this is more of an inflamed sebaceous hyper... And you're comfortable?
Mm-hmm.
So you can see the contours of the cyst there.
Mm-hmm.
Sort of just push tissue around as opposed to, like I might use the scissors, just in a very fine fashion. I'll show you what I mean. So here with these Crileys, so you can open that up. It doesn't dissect down tissue very well. Here. I'm using the scissors, so that might help me a little bit more.
Just find a hypodermis and then stop it.
Yeah, once I get down to the hypodermis, just down a little bit. Down that. And that's the bigger, the second part of it, behind it. So that's what I'm looking for. There's the hypodermis. But there's a bigger subsection off to this side, which I want to make sure we're getting.
Trying to file the traction down.
Yeah, it wouldn't be bad actually. Well, that's why I mark it with the marker. There we go. So that's going to be. Yeah, I just want you to appreciate it because sort of you can see it there. There you go. That's the keratin there. So you think that's epidermoid? Yep. So now we just want to get the thin suture material. Good. So that's what I was saying. It's just tedious. Like it's the tissues are fighting you a little bit. Mm-hmm. Just like that. You're comfortable?
I am.
Is there a reason anything finer than 6 up? No, that's what I have up through here. I find here it's pretty decent. You okay? Oh, she's... Yeah, just keep her safe. We'll just clip this one. Short. Just give her a sec.